Hey guys, NCWQ here, and I wanted to jump on for a minute and talk about something which is going on. And I don't know if it's happening to other people. Shout out in the comments if it is. But I'm going to talk about Medicare and Medicaid and prescription drugs. I have for a long time been on certain medications that I needed. One of them is an inhaler that I use when I need it, as I have allergies. And had been having this inhaler now for going on 5 years. And I went in to go get my new inhaler because I needed to pick up a new one. And come to find out, it's no longer covered by my plan. And I thought, well, that's strange. And they told me, yeah, your plan no longer covers it. And I'm like, huh? And I've come to find out that my plan no longer covers quite a few of my meds. Well, I've done a little bit of digging and I found out that Medicare is excluding things, and they can do it by law, but you also have the right to ask your plan to provide for and pay for a drug you think you that should be covered, provided or continued. You have the right to request an appeal if you disagree with your plan's decision about whether to provide or pay for a drug. Just so you know, you do have that right. A lot of people don't know that under Medicare. And hang on one second. Chris, can you grab that out of the oven? I am doing a live stream. I forgot. And so anyway, there were new changes that came to Medicare in 2024. And let's tell you what some of these were. Starting January 1st, 2024, if you have a Medicare drug coverage Part D and your out-of-pocket drug cost reaches $8,000 at catastrophic coverage phase, you don't have to pay co-payments and co-insurance for the rest of the calendar year. Note that according to the KFF, this provision will effectively cap out-of-pocket costs at approximately $3,250 in 2024. In addition, the Part D Extra Help program, which is what I'm enrolled under, which covers your Part D plan costs, will expand to people with incomes up to 150% of the federal poverty level. This is up from 135% of the FPL. People who qualify will have zero premiums and deductible costs if enrolled in a benchmark plan. Well, I paid on mine today. In 2024, California has two benchmark plans accepted new enrollees. Prescription drug copays are capped at $4.50 for generic and $11.20 for brand. Also, coinsurance amounts for some Part B covered programs may be less if prescription drug prices increased reach higher than the rate of inflation. This is thanks to the new Medicare prescription drug rebate program. A reminder of 2023 changes, your insulin cost sharing is capped at $35 for a 1 month supply of each insulin product Part D covers, and you don't have to pay a deductible for it. This also applies to insulin used with traditional insulin pumps under Medicare Part B durable medical equipment benefit. Anyway, chronic pain management, which is what I'm under, if you've lived with chronic pain for 3 months or more starting January 1st, 2024, Medicare covers monthly services, including assessment, medication management, and care coordination and planning. Medicare's Part B deductible and 20% coinsurance apply. So anyway, I've just been reading through the changes to the telehealth. Um, you can do telehealth. I do telehealth sometimes. But my biggest problem was finding out that I went in to go pick up medications and finding out that some of my medications are no longer covered under the program. Not sure what I'm supposed to do about that because it didn't make any sense to me. Then I was told that I needed to reach out to my doctor and have my doctor prescribe something else because Medicare and Medicaid no longer cover it. What happened to the Right to Try program? I thought that there was a Right to Try program. I never assumed that after taking a certain medicine for 5 years, all of a sudden they would say, oh, well, you can't take that one anymore. By the way, you can ask your doctor to give you something else. Is just nutso. So I'm wondering if anybody else has been having the same problem, if it's just here in North Carolina or if it's around the world, around the United States. It kind of ticks me off because, when you get used to taking something and your body gets used to it, and then all of a sudden, by the way, you no longer have that medicine and you have to start on something new, it can cause you all kinds of problems, like make you sleepy, make you drowsy, make you sick, give you a headache. Um, you understand what I'm saying. Um, thank goodness my doctor was able to cover me like ASAP with something else, but it's kind of got me ticked off because three of my medicines have been done the same way, and I had been taking those for a long time. So, um, yeah, that's the overview of Medicaid and Medicare um, for 2024. Things are changing. The amounts are going up. I'm going to tell you guys right now, I take 12 different medicines each day. And when you have to buy those at 450 a piece, count up 12 times 4, that's $48. That's quite a bit for somebody who doesn't have a steady income and has to take those medications. And I buy them at least, thank God, once a month. If the doctor does a 3-month supply, then I'll only have to pay for it once every 3 months. But with 6 of those, I cannot have those done every 3 months. They had to be done every month. With the other one, they could be done every 3 months, but then the doctor doesn't do them every 3 months. He only does it for every month. So, yeah, that's what I end up doing. I end up having to pay each month for those 12. Anyways, let me know what y'all's thoughts are. Um, I just wanted to know if anybody else is going through the same issue um, and what they're doing about it. Anyways, you guys, much love. God bless, and I hope y'all have a great day.